Hi, my name is Jordan and I'm a very passionate nurse, especially in hospice care. And I want to bring up a topic that a lot of people, it's either talk about morphine, and this is the other one. This is called antibiotics. In hospice, yes, we do treat some underlying infections like UTIs, localized infections we'll treat, and those come with antibiotics. But I want people to know, this is an educational video. This is not about telling you what you should and shouldn't do, or what I believe one should and shouldn't do. But this is just so that people know that there's two sides from treating as well as making people feel comfort. So first thing is say you're on service for heart failure and you have a lot of edema, you're on medications to help with edema, you can't breathe well, so maybe you take a little bit of Roxanol with that. You just have so much going on. You're taking a lot of medicines to help keep you comfortable. Well, lo and behold, you develop a UTI, and a UTI is a urinary tract infection, and you kind of have some burning while you pee, or you might have some abdominal cramping, and that's how you kind of started noticing you had a UTI. Well, being in the bed, you're like, should I treat this UTI? Should I not? Treating the infection of this UTI does not fix the heart failure that's currently going on, right? So why you have UTI is the big thing. Okay, being bedbound, are you starting to retain because your body's slowing down? Are you having some kidney issues? There's a lot of other things that have been going on why you have this UTI. So treating this infection with antibiotics does not fix the underlying issues of why you're really on hospice services for your heart failure. The other thing is, and this is something I say with love, one second. Sorry, my dog was playing. The other thing is antibiotics can prolong the dying process instead of improving the quality of life that's currently going on. So what I mean that is, let's say we're going to treat this UTI. Okay, it helps fix that issue. But now, because you took these antibiotics, you're having nausea, you're having discomfort, even confusion can occur. So there's that, because more side effects can come from antibiotics, especially if you have some pretty gnarly stuff growing in your urine specimen. So there's that. So the thing is I'm trying to just give an example, but the one thing is hospice not treating an infection does not mean as a loved one you're giving up. Comfort care is a consistent, active treatment. You're looking at the pain, the breathing, their anxiety, their agitation. You're always working to make sure their quality of life is the best it can be. So these are the questions. If you're still pondering, should I give antibiotics? Should I not? Should I want to do this? Should I not? What would make the most sense? What would make the most peace? What would this person want? Is comfort more important than prolonging? Selfishly, the first thing I think of for my husband, I want him forever. But is my want of prolonging worth their comfort? And I'm not trying to step on toes. I'm just trying to bring light to situations that occur so that you have in the back of your mind these questions and answers that you can already be thinking about or currently going through. But you're not ever giving up if you don't treat an infection that may occur. All you're doing is focusing on what is the most important task. You have the right to do anything, but what is that thing you're going to do? I hope this helps someone, and I hope you have a beautiful day. And if you're currently going through this or you went through this, I'm sending you a huge hug, because it's a very isolating feeling to make these decisions, a lot of decisions, almost like decision fatigue. So I'm just sending you love, and I hope you have a beautiful day. Thank you for listening.